To open our presentation with that, because Dr. Sen had asked me, I've been invited to lecture this class the last 3-4 years, and what I always want to do is invite our colleagues who are Pacific Islanders, who do teach, and who has a complementary lens to help from their perspective to really understand our Pacific Islanders. And so we're very fortunate to be here and have this opportunity. I'm going to have to drink a lot of water today because I'm really hydrated right now. So, but I am really excited. So Winston said, Tau, I'd like for you to talk a little bit about yourself. And who likes to talk about themselves? One thing about Pacific Islanders, that's not something we do well, but it's an honor to be here. So what we're going to talk about, like Winston said, I'm the project manager and project officer for the Racial Equity Initiative at the Asian and Pacific Islander American Health Forum. I've been with the forum over 5 years, going on 6 years. I was hired from the forum from Hawaii to oversee the Native Hawaiian Pacific Islander affairs on a national level, so national, state, and our U.S. jurisdiction. And so what I like to talk about is how did I get where I'm at, just to give you some information about us. And my name is Taunu'u Ve'e, and I'm descended from Samoa. I was born in American Samoa. But I moved to the mainland in Northern California, and where I grew up in Sunnyvale, as you all know, in Sunnyvale, California, since age 7. I was raised from my uncle, who is also a minister, and wow, it's a long way back. It gives me a lot of good memories. I came up here because I lost my mother with breast cancer at age 6. And so I was the only child. So I was sent abroad to go to school here. And I have an uncle who is a minister and grew up all my life in Sunnyvale, California. So coming to Sunnyvale, California, I attended Sunnyvale High School, which is no longer exists. So, you can tell how old I am. But all my life, I grew up in Santa Clara County. And so after high school, went abroad to attend San Jose State, Cal State Dominguez Hills. I graduated my master's degree from Hawaii at University of Phoenix, believe it or not, in business administration. This work here, I never thought I would ever end up in health, public health. But it's actually not public health for me. So the work I've been is that this initiative, the racial equity work, it's really talking about, so what do I do with the racial equity initiative? Kellogg, it was looking for an anchor institution that focuses on doing the work across the nation on racial equity. And so they were looking for an organization on a national level to present this population in addressing structural barriers, structural racism, institutional inequities. And when Winston was talking about racism or racial earlier today, it was fitting for me to stand up here and talk to you about it, because our world out there does not understand racial equity in the same way. And so part of our initiative is really, what is our term? What is the Asian and Pacific Islander term? And as you can see, when Vika talked about earlier, we're still lumped together on a national level in Congress and many national front. And so for foundations, we're still looked at as API. And so my work in racial equity is, how do we address and how do we identify structural causes of inequities through access to food, health, and wellness, education and learning, or economic security, family economic security, that is affecting our children and families across the nation. And so My work spanned through 5 states, and these states really addresses specific Asian communities. Mississippi and Louisiana, this is the Gulf Coast. As opposed to Katrina and the oil spill, a lot of our fisher folks and farmers have been heavily affected by all of these, not natural, one natural disaster, but the other one is man-made, and address what were some of the services that has been provided to our marginalized community. Actually, the Vietnamese fisher folks were actually a vulnerable community in Mississippi. Louisiana is our farmers, as post-Katrina. Hawaii, we decided to do the youth civic engagement and our racial equity. How do we hear our youth voice, and how do they learn about the civic engagement process to be heard? And we thought of Hawaii because they're a melting pot. They're a mixture of a lot of different race. And so not only that, but it reflects what API look like. And if we all, and how does this island, small island, have all of these mixed culture get along and work well with each other? And so not only that, but they're the first Keiki caucus, which is the children legislative, ever established. And so for California, we decided to approach our community, our Pacific Islander community. What are the structural barriers for you? They've identified education and learning. So the work that spans across all of these, you can see it's very different. Our Michigan is with our South Asian community. And in Detroit, I don't know if you all know that there are 4 mosques in Detroit, Michigan. We have an Arab community, Bangladeshi community. There's a rapid growth of our South Asian community. And so they're facing a lot of social determinants themselves. And they're the newer population that migrated to the United States. So overall, just to give you a sneak preview about the racial equity work is, what is our community-led and community-driven? We are allowing our community, we're funding them to identify their own structural barriers. It's not from the health forum, it's not from policymakers, it's not from leaders in their community. We want the community to come together as a collaborative. So there's a total of 24 organizations, CBOs, that come together. There's 5 collaboratives of these organizations, all serve Asian and Pacific Islanders. And then at the end of the day, the goal is not only how do we address what those structural causes, but also how do we work across with our other multiracial communities as Latino community, the Black community, and our white progressive community, right? Because we all want to live in the same neighborhood and be able to have the same opportunities as everyone else, right? That's the goal. And so, so that's the work that I do with the racial equity. So this is just to give you for the California. The California are groups here, they focus on education. Our Pacific Islanders, they have the highest high school dropout rates in LA County. So the focus is how do we improve these numbers, and what do we need to do? There's a lot of education programming for college graduates, but a lot of our students are coming back that that's not working. How do we work better? But we want people that look like you. How do they make it, and how can they become our mentors? And so they created a pilot project called Pacific Island Leaders of Tomorrow, and not just focusing on mentoring up, but also a mentoring down. And so what we were finding is that there are college students, the high rates of college students from the first and second year. So we want to make sure we stop those from dropping out, and we also want to make sure that we have our professional Pacific Islanders also mentor those that want to stay in college, but they just don't have the means or the resources or people like them to mentor them, right? So this is the work that they're doing. There's 7 organizations that all work with education and learning. And so they come together as a collaborative. Who would have thought we have Native Hawaiian, Chamorro, Samoan, Tongan community-based organization coming together for a common agenda to really improve the education and increase the level of education for our Pacific Islanders. So we talked about the Hawaii Aim for Youth. Aim for Youth of Hawaii, they wanted to create a mechanism to invite policymakers to hear their voice. And their voice is, you're making decisions that's going to affect us years to come. How come we're not at the table? So we're focusing on youth ages 16 to 25. And this mechanism is really inviting the youth to listen to policymakers who are discussing issues regarding the children's issues and youth issues. And this is an opportunity for the Youth Advisory Group to learn about these issues and take it back to their own community. Is this really the issues we're facing, or is it not? And so this is a very engaging process, and there's 20 youth make up of the statewide advisory council, and they're all from the neighbor islands and also in Honolulu. So that's the work that this is just a snapshot of the work that we do on a national level. The other hat that I wear is the Senior Advisor to the Health Forum on Pacific Islander Affairs. And so what I wanted to do in my next few slides is really just to give you an idea of where we are as a population. And I know Vika had mentioned before about the API category. We have been Asian and Pacific Island for a long, long time. We've been lumped with the Asian communities. But what happened to that in health is that it masked a lot of our health disparities. It masked a lot of our social determinants that really would have revealed a lot more worse. We are worse off than some of our Asian American population. And so, so from the 2000 to the 2010 census, the Asian and Pacific Islanders have the highest rapid growth in population. So we're growing very fast. And so when we think about the makeup of the landscape of the United States, this is something that we really need to take a look at when it comes to social determinants. You also see the Latino community with the rapid growth in that community as well. But if you look at the African American, the growth is not as fast as as the other 4 groups. For a Pacific Islander alone, this is the population that we came up with 2010 census. And when we did community outreach, that number, sometimes we hear from our community it's a lot higher, but that's okay, that's still a lot. We've reached 1 million. Okay, that's 1.2 million. That's still a lot, right? For our Pacific Islanders. I wanted to show you this because when we were talking about lumping Asian and Pacific Islanders together, you see the number that we have on the left for Asian Americans. This is 17 million versus 1.2 million. So when you lump these statistics together on the state level, they're not disaggregated into A versus Pacific Islanders. What happens here? Let me ask the group here. What happens to that? What happens if they're not disaggregated?
They get buried
Yes,
into the Asian issues.
exactly.
It's hard to get funding without disaggregated data.
Yes. And if you can imagine, we're only talking about Hawaii and these areas where the United States have its jurisdiction. But can you imagine all the other states where a lot of our community reside? They're unheard, I mean, it's unheard of. Their data are not being collected because they're not aggregated in Department of Health, Department of Education. So really, we don't even know how well they're doing in a lot of our states, right? So it's, that's been the fight that the Pacific Islanders have been fighting for a long, long time. And still today, 2014, Congress still looks at our population as API, not Asian Americans, and Native Hawaiian Pacific Islander separated. So in 2000, that's when our category separated from the Asian community. So although the OMB 15 declared that the federal government is mandated to separate all of our categories from the Asian to the Native Hawaiian Pacific Islander, a lot of them are compliant on the state level. But where do you think the state level get their data from? I mean, the federal government, the federal data, the state level, right? And then the state level gets it from their local, the counties. And so if it's mandated on the federal level, it's taking a long time for it to come down to the state level. So again, there's still Department of Health and Department of Education, even in California, you know, that the data are still not disaggregated from the API, to separate the API community. One more click. So this is to give you who are the top highest where our Pacific Islanders reside. These are the top 10 states. I thought it'd be fun to show you those states there to give you an idea. Well, you know, I didn't know there was that many people in New York, let alone in Florida. And so we're, you know, the Pacific Islander is pretty much on, if you saw that diagram I had, they're in all of the states. One or two here, you know, it's smaller population, but this is over 10,000 are in these 10 states. And then the next slide, it breaks it down into 5 states that has the highest numbers of Pacific Islanders. And for Utah, we have New York and Florida that tops Utah now. So something is going on there, right? People are moving to New York. I think it's military. Florida, they're moving to Florida. And the reason why we're showing you this is that this is where the movement, where Pacific Islanders are traveling to. So I want to do justice to all of our Oceania Pacific Islanders, to put all of their names up here that makes up who are Pacific Islanders. Pacific Islanders, these are people that are having origins in any of the original people, and it says Hawaii, Guam, and Samoa, and other Pacific Islands, but all of these places, Micronesian, Melanesians, these are all, this is all Pacific Islanders. And for the United States, some of you might see some of the names that look familiar. So when Vika was talking about the map, which I'll show you, there's another slide over here. So the U.S. jurisdiction, there are islands that the United States chose mainly for their own political powers and what have you, and protection of the United States. So they call it the these are 6 U.S. affiliated Pacific Island jurisdiction, and they are comprised of 3 territories, American Samoa, CNMI, and Guam. So these are the 3 territories. The 3 freely associated states are the Federated States of Micronesia. So you may hear the term FSM. So the 4 states in in Micronesia, FSM is Koshrai, Yap, Pohnpei, and Chuuk. Okay, those are the first state nation inside the Federated States of Micronesia. The Republican of Marshall Island, and also Republican of Palau. And each of these 3 associated states have different agreements with the United States. Altogether, these freely associated states are called COFA. You heard the term compact or freely associated, compact, impact. So whatever the compact agreement that impacted these islands, each of them have different jurisdiction and political agreement with the United States. And so that's why they're called COFA migrants. They prefer COFA citizens, and they come from these countries. And there's a lot of stigma about COFAs around because they're migrating. And they're migrating. There's a whole new presentation about the bombing, the testing of the nuclear tests that you can go and Google in Republican of Marshall Island that really displaced a lot of our Micronesian over to the United States, to Guam, to the different islands nearby for medical assistance. And sometimes there's latency in a lot of this nuclear bombing, so they won't detect that immediately until really late after many years. And so they're displaced because they're not medically, they're not set up for medical assistance, for health providers and health care assistance. So there's a lot of talk. There is agreement. There's appropriation that's going to the Micronesia, but it's not enough. It's not enough, and this is a fight that they continue to fight. And so a lot of our Asian brothers and sisters on the national levels, we're all rallying behind our COFA migrants to really help them. But they're really not immigrants. They're not refugees. They're here freely, and they can free to come in and go out as much as they can, but they're not qualified to some of the benefits, like health. And so, this is, and then we have the state of Hawaii, which all makes up the Pacific Islanders. Okay.
Question?
Yeah.
I know the Marshall Islands are also looking at displacement because of environmental issues with the waters rising. At that point, would they be considered refugees and be able to access services? I'm just curious if you have any idea.
I think there's a lot of talk about global warming that's happening right now, and there's still talks about that. I want to say they should, and they are in some area. But when it comes to health related, like the ACA, it's coming down to state decisions, because that's what the bill is made up for, is it's up to the state. But we have the territories that are really championing the resources, like Hawaii and Guam, providing the resources for these islands. But the talk that they're talking about is because of the water rising. So what happens to a lot of our islands, and what is the United States going to do about it? Actually, it's going to become a UN issue, and not just the United States. The United States has only a portion. You saw all the other islands, right? They're under other powers instead of just the United States. I listed those US Pacific jurisdiction for a reason, to kind of help you the lay of the land of the United States and our Pacific Islanders. But we do work with the UN as far as the health is concerned on other levels, on non-communicable diseases because of trafficking, and even in our Asian countries, So those are issues constantly happening. Slide. So this is the map that we were talking about. With the exercise that you did earlier, I think the last count, there were about 30,000 islands in the Pacific. It's a lot. And the area is like roughly 60 million square miles of ocean real estate. So, But we put a map of the United States to show you the body of water between all of these Pacific Islands. And when we talk about health disparities and access to health, to healthcare and just healthcare and providers, transportation has been a big issue here for our Pacific Islanders. So what I wanted to get into, I got about 4 minutes, which is okay. I wanted to just give you some statistics about, you know, some of our data that we kind of sum it up for our Asian Pacific Islander first, and then break it into our Pacific Islander, where the causes of death and so forth. So the 10 leading causes of death for our AA and Pacific Islanders is listed over here. So the top two diseases make up 50% of all deaths, and 1 to number 9 are behavioral related. 1, 2, 3, 4, and 8 are diet and patient related. Yes. Diabetes wreaks havoc to all organs of the body. Of course, this is plaguing our Pacific Islander, and I think a lot of other vulnerable community across the nation. And so the major causes of premature death among Pacific Islanders, this is the top 4. And we're finding in diabetes, the other premature death in Alameda County is also our prenatal. This is an infant mortality. Is really becoming a high percentage in our Samoan women out of Alameda. And we're also finding in some of the outreach is that a lot of our women are having their children and they're obese. Some of them are having their children when they're still they're diagnosed with diabetes as well. And so there's a lot of complication, lack of education with prenatal care, and there's not enough outreach, not enough organization to serve our communities in Alameda County. So what we try to work with is working with our other community-based organizations that serve Pacific Islanders. We also work with our Latino group to educate a lot of our communities, but we're also outreaching to our faith base, okay? So I have a funny story to kind of close this up. My brother is a minister in our church in Oakland, and he's diagnosed with diabetes, and it took a long time for him to stand up there to say and admit that he is diabetic. But when he did, it was a huge transformation of that, because what we do now is our church started a Biggest Loser campaign, because we have a lot of obese and a lot of diabetes patients in our church. And so not only does it start from our community-based and nonprofit organization, but also it should start from our faith base. And that's where a lot of our communities get their information, is through the faith base. And so we started that in December 7th, and we're seeing a huge transformation in our people's behavior when they see pounds losing, right? I'm one of them too. So, you know, what we have to do is we have to take action in all of what we do. And these are more statistics for our Pacific Islands on health disparities. And what I wanted to end on there is, there's a lot of statistics that we want to give you, but I think it would overwhelm you, because there's a lot of resources where these statistics come from. That's why I'm not one to show a lot of data, because the resources and the methodology that's used to collect these are very different. I think the message that I want to leave with all of you is pretty much this diagram here. And you heard the saying, it takes a village to raise a child. for the health and well-being of vulnerable community like the Pacific Islanders, it takes all of us to understand, one, who is the community, right? If you can follow the cycle. Two, what are their needs? Three, how to help this community create urgencies. Four, identify intervention. And five, how do we monitor the impact of the identify intervention? And I think what we did today, it was really helpful. It may not be a lot, but I bet you one thing, you know who Pacific Islanders now are, right? How many of you know Pacific Islanders now than you did before you got here? See, and that's, to us, that's success, because the more you learn about the communities, the more you have a better understanding on how to help them. Because APIs are still working together. Doesn't matter if we're separated categorically, right, when we're collecting data, but when we do a lot of work, even all the communities, they say communities of color, that you're going to use a lot of those, the racial context, but still, I think as communities across the nation, the vulnerable communities, those that lack access, I think that's the bottom line. I think that's what we need to do with all of us. You know, when you're learning, when you're in public health, you know, remember those things. And it's not about race, the color of your skin. It should not be, you know. It should be the condition of where we, you know, of our communities who need our help. So with that, thank you so much for the opportunity.